Hello everyone and welcome to Inside Healthcare. We begin with a medical miracle that's giving new hope to disabled kids and adults. It's called a Fitbone. In a moment you'll meet a young patient who was one of the very first in the country to undergo Fitbone surgery, as well as meet his surgeon, one of the first surgeons to perform Fitbone surgery in the whole United States. But first, an exclusive video you'll see only here, shot and produced by Emmy Award-winning videographer Monty Stumpert and myself, as we followed the very first two cases in Minnesota before and after their life-changing surgery.
Her right femur is 47 centimeters in length and her left femur is 42 centimeters in length. In addition to the short femur, she's got a deformity of the femur, so it's grown crooked. And the tibia is grown crooked in the opposite direction. This growth plate of her lower femur is arrested completely. It's stopped growing.
When I come home after my basketball games, I can barely walk anymore.
The first thing that we're going to do is we're going to straighten your tibia bone. And the way we do that is we make a small incision, we take a little shim of bone out like that, and then we correct that deformity. So when surgery is done on Thursday, your bone will be completely straight. Then we insert the rod inside the bone, and once the rod is locked in place and the bone is cut, we wait 4 days. And then the stimulator starts. You do that 3 times a day. And as you do that, your bone grows and grows and grows and grows a millimeter a day. And it keeps growing a millimeter a day. And then your body grows new bone in here.
It's hard when you see your little girl come home and be in pain and, you know, things that didn't, in the surgery before didn't go right. So Dr. Dahl has given us the hope to fix all this. So for me, it's incredible.
At the end of the day, my lower back's always sore because I walk with a kind of a tilt, you know, because my left leg's 5 centimeters shorter.
I think we're really lucky, really lucky, and it's just going to be nice to have his leg the same length and get rid of the back and knee trouble.
It's very powerful. This implant has a diameter, or let's say, of less than my finger, and has a power of about 2,000 newtons. That is more than double of your body weight. And it has a technique that is very good to control. The energy source is outside of the body and it's coupled inside the body via a transmission system. So it's very safe. And I think it's it's very effective.
We were pretty nervous, but we had a lot of confidence in Dr. Dahl. And we knew that she was in good hands, and the doctor from Germany, and you know, so I mean, we had no doubts. It was just letting your little girl go into surgery for 6.5 hours while you're sitting in a waiting room. It was a tough day, but it was worth it. He showed us, you know, what Danny's leg had looked like before and what it looked like after the surgery, and he said to us, it's absolutely perfect. And it was the most incredible moment of my life because Danny was going to be okay.
The operation was perfect, and the surgery everything was very good, and the equipment, a good team here. So it was for me also a great pleasure to be here.
He said, well, thanks for coming to the surgeons, and he was just pretty happy young man at that point. I think he was still pretty numb from the surgery and just happy to have it done, and that he also knew it was really successful.
When you lengthen it, you can't really feel it. Like for me, I could hear it without the stethoscope we use. I could hear it, and then the vibrations, I can feel them that like go up to the middle like of my chest or whatever. So, but it doesn't really feel like you're stretching it.
you lengthen the bone, but in addition you lengthen all the soft tissue which is around. You lengthen the nerves, the vessels, the muscles, everything is lengthened. And that could create problems, for example nerve problems, or create contractures of the joints. So you have to control it very carefully.
Every week you see more and more bone, and the density of the bone is better.
Today the leg is straight and has the same length at the other side.
Best day of my life. Yeah, best day of my life.
It was unbelievable what he had done. It was just, wow, incredible.
I get excited knowing that it's almost over. All we have to do is wait for the bone to fill in.
And we're very excited to have with us Alex Braun and his mama Andrea, and also Dr. Mark Dahl, orthopedic surgeon with St. Croix Orthopedics in the area, from the area. So thank you all for being with us. Really appreciate it. So Alex, how are you doing? You had your surgery, it looked like several months ago now.
Yep, in December I had surgery. I'm doing fantastic. I just got off of crutches about a week ago.
I know, I wish our viewers could see you walking. It's just amazing to see you walking.
It feels incredible to walk again after 8 months. I got out golfing for the first time this season. It's just nice to kind of be getting my life back.
And how was it on the golf course? I think we talked about.
It was difficult, but it was great. Instead of taking the cart to my ball, I'd always say, all right, I'm going to walk to my ball on this next shot, because just being able to walk again was incredible.
And they're exactly the same length now, or very close now?
Yep.
So, and the problems that you were having before, you don't have anymore now?
Not at all. When I walk, my back doesn't hurt anymore.
Wow, just amazing. Andrew, how was it for you as you're watching your son going through this? And it looks like you had to actually help stimulate that, worked on it.
Right.
Learn things that you hadn't done before.
Right. I think you referred to the Fitbone as a medical miracle, and it has been a medical miracle for our family. Prior to the surgery, I was really excited that Alex was going to be one of the first in the country, and I was also anxious at times. But I focused on the end goal, which he ended up getting, 2 legs the same length. We had the surgery at Woodwinds, and they did a great job with pain management and alternative therapies. He had acupuncture, aromatherapy, healing touch. And when we took him home, it was a very busy first 5 to 6 weeks, because we lengthened his leg 3 times a day, and that continued for several months. But in the beginning it was difficult because we had to unwrap his leg and take care, because the movement hurt his leg. Lengthen it, rewrap it. I did a lot of healing touch. Woodwinds had taught me that, and we did aromatherapy, and we got through it. I think Alex doesn't remember the first month so much. He was on pain meds. That was probably a good thing. And then the pain subsided, and he started slowly to get his life back.
And I think you had mentioned one other time previously to me that the healing touch actually would put Alex to sleep. It was so calming and soothing and do away with the pain and stuff.
I don't remember it, but she said that when I was in the hospital, they came in to do acupuncture, and there's pictures of me sleeping while they're doing it. I don't remember having it at all.
So obviously it was very healing and
relaxing
for you. Now Danny said she couldn't really feel much, just kind of a vibration. How about from your perspective?
Yeah, I could feel it in my neck. I could feel a dull humming, but I couldn't feel anything in my leg. It didn't hurt at all when I lengthened it.
Isn't it just amazing when you think
incredible.
back about it?
It's incredible.
How far you've come. And Dr. Dahl, since then you've done some other cases as well. They were a couple of your first ones.
We have. We've done several more cases, and we continue to select the patients very carefully for this. I think you need to understand that perspective on this is that the Fitbone surgery is a completely implantable lengthening device, whereas opposed to the traditional lengthening is done with an external fixator, which is a fabulous tool, but it involves having pins and wires anchoring the fixator to the bone, and the entire device is external. And so with an implantable lengthening device, you completely eliminate the pain and the discomfort and the tethering that the wires and the pins have on the muscles and surrounding skin and the soft parts of the leg. It's all the same. It involves regenerating or growing new bone. It involves cutting the bone. It involves doing major surgery. It's not little by any means, but the recovery is much, much gentler for the patient. And I'm privileged to be able to offer this to my patients.
And you're one of only 2 or 3?
There's 2 of us in the United States, Dr. John Birch in Texas and myself. And there's considerable training that is required. The German surgeon, Dr. Baumgarten, is quite a taskmaster, and he's very, very keen to have this done exactly correctly. So he's only selected 12 surgeons in the world to do this. And I've done thousands of limb lengthenings with external fixation, and so I've gained tremendous experience over the years, which set me up to be able to move into the Fitbone surgery with a relative ease.
For it to be internal there, can you kind of explain, as easy as we can understand, what is going on? How does that work?
The device is actually a rod, which is a metal tube. Now, orthopedic surgeons use these metal tubes or rods inside bones for fracture repair routinely all over the country and all over the world. But what this rod is a rod within a rod. And in the innermost rod, there's actually a small micromotor. And the motor has an antenna. And the antenna is attached to a receiver that's placed right underneath the patient's skin. And the incision to put the rod in is very small. It's less than 1 inch in length. And the bone is prepared from the inside out with specialized reaming tools, and the fit is precise, thus the name Fitbone. And the bone has to be separated in a specific way, saving the lining tissue around the bone so the bone will regrow. And you have to wait for 5 to 7 days for the bone to start growing before the patient activates it. But the patient and family do the activation 3 times a day under the direction of the doctor based on the weekly visits that are required.
So it's not only growing, but it all has to be very measured, and you can't grow it too fast or too slow.
That's right. If you stimulate it too fast, the bone won't grow properly. If you go too slowly, the bone will grow prematurely and will not separate to your specifications. In addition to that, you have to plan the surgery differently than any other surgery that you typically do, in that you use a computer graphics to plan the surgery and predict where the bone is going to be when you're done with the lengthening.
That's where your experience comes in.
Because of course you lengthen along the axis of the bone, which is not necessarily the line that you want the patient's limb to end up in. So there's a bit of a chess game to it as well.
Now, the Fitbone is still in his leg,
yes,
but you'll be taking that out in once you have enough bone in there?
Somewhere around a year after the initial surgery. The entire bone will have grown in such a way that we won't even see the new bone that's formed. It'll look like
Like you never even had a
That's right.
surgery or anything?
That's right.
And that's a simple thing, just kind of removing that from the
It's an
Fitbone?
outpatient procedure. It involves a general anesthetic, but it's a simple approach, and it really won't hold them back for much.
Now, who is a candidate for this and who maybe is not a candidate for this type of surgery?
Candidates that I treat for Fitbone surgery are people with leg length discrepancies, that is, differences in their leg lengths. People that have, like Alex and like Daniela, that have substantial differences in their leg lengths so that they're walking with a tilt in their pelvis and a tilt to their spine, and they're developing pain in their other joints as a result of this. This isn't done for cosmetic lengthenings in my clinic, and the patients are limited to those that have significant dysfunction and problems as a result of the difference in their leg lengths. Along with this, they can have deformities of the bone. It can occur from either trauma or failure of bones to heal. It can occur with bone defects. Children with congenital deficiencies that have short limbs are good candidates for it. Patients that have had previous infections that are now cured are candidates for Fitbone surgery.
Yeah, and Alex, you were saying that yours, you think, your injury stem from a dog bite?
Yep,
To the knee or to the leg? Or?
I had a dog bite on my left calf, and it twisted the knee and put a lot of pressure on it.
You just don't think of something like
Alex
that.
had what's called a bone dysplasia, and his knee was tilted and knock-kneed in addition to being short. And so we had to correct the angulation, predict the path that it was going to end up in, and correct the length.
And you mentioned Daniela or Danny. How is she doing, by the way?
She's doing great. She has a full correction of her deformity, equal leg lengths, no symptoms. She's walking without
You have
crutches.
to be very pleased
Oh, I'm delighted.
with the outcome and
I'm
the progress.
delighted.
So what's the prognosis then? Just
Well, Alex and Daniela will both have normal function. They're going to have completely no trouble with their limbs in the future.
amazing. Are there? You had mentioned that there's the standard way with the apparatus on the outside. Are there any other alternatives for patients like this available?
Well, if there's a difference in the leg lengths and it's a growing child, there's a very simple way to correct the difference in the leg lengths by slowing the growth on the longer leg. And this is only for children that are actively growing close to maturity for a difference between 1 and 2 inches. And for adults that have a leg length difference that is less than 2 inches and greater than 1 inch, we can actually shorten the longer bone. But in each of these cases, the bone angle needed to be corrected in addition to the length. And so the alternative of shortening the other bone wasn't suitable.
Where do we go from here? What if someone is interested in saying this is something that maybe this might help my loved one or something?
Well, I think the thing to understand is that these are not everyday cases. These aren't people that typically are troubled by a small difference that a lift in the shoe can correct. So these are patients that are having considerable problems with this. And the simplest thing to do is just to understand what the extent of the problem is, and if there's a question, see your doctor about it, and then from there, if it's felt worthy to pursue it, then they certainly can do that.
If you had to do it over again, would you? And what do you tell other people in a heartbeat?
Yeah.
No hesitation there at all?
It was a lot less painful than I thought it would be, and from what I hear, it's a lot less painful than a external fixator. So if you have a choice between the two, definitely go with a Fitbone. And I know it's not an everyday surgery, but it was a great thing, and I'm glad I did it because I'm going to have almost a normal life now. I'll be able to walk and play basketball without having any pain in my back anymore.
And trying to work on that golf game as well?
Try and improve it a little bit.
And Mom, what do you think?
I think Alex gave up some months of his life to heal and to commit himself to this. And in exchange, Dr. Dahl gave him a new life, a normal, good life, where his back and knee and hip won't be bothering him. So thank you, Dr. Dahl.
And Dr. Dahl, any final comments that you want to leave with our viewers about this Fitbone surgery?
Well, you know, we can't oversimplify this. It's a difficult process.
It really
it's really
is,
involved in. It requires the use of a team, and I've assembled a wonderful team at Woodwinds, and we're delighted with the way all the moving parts are kept working together, and we've forged a wonderful relationship with Dr. Baumgarten in Germany and Dr. Birch in Texas, and the two of us are going to be the United States and Western Hemisphere Fitbone surgeons for the foreseeable future, and we're just delighted to be a part of it.
And I know we're sort of running out of time here, but just quickly, you had mentioned that there's actually 2 types of Fitbones, or they have different functions?
There's 2 models. One of them actually pushes the bone to separate it like an elevator, and that's Alex's model, and the other actually pulls or draws the bone into the rod, and the rod actually slides within the bone, and that's for different specific applications.
All right. Any other final comments about the Fitbone or about the surgery or about going through the whole ordeal?
I want to thank Dr. Dahl and his staff for helping me get a new life. And
Alex said that it'd be almost normal. The reason he's not going to be totally normal is because he's such a wiseacre.
This is true. Right? It's true. The light will be normal, but the rest of it.
And I believe the Healthiest Orthopedic Care has a number that you can call too if you do want to have any other questions. That number is 651-232-4498. Oh, so we want to thank you all for being here. This has been just fascinating, just
Thanks for having us.
amazing. Yes, absolutely. Thanks, Alex, and thanks, Dr. Dahl
Thanks.
and Andrea. Appreciate it. So still ahead, a centennial celebration for St. John's, your community hospital, so stay with us.
Well, first of all, congratulations. I mean, 100 years of being able to help kids get back, get healthy. You know, whether they're aspiring to be baseball players or doctors or whatever the case may be, St. John's it should definitely be congratulated for letting those kids have that opportunity to aspire and reach their goals. And congratulations again on 100 years. That's pretty special.
We're the Journey Girls, and we love to watch On Location TV19. Woo!
Welcome back to Inside Healthcare. St. John's Hospital first opened its doors in September 1911, and this September kicks off its 100th anniversary. And we're very pleased to have back with us Scott North, the Vice President and CEO of St. John's Hospital. So thank you for being with us to tell us about this huge celebration. What an amazing, to have to be the CEO during the 100th anniversary of this hospital.
Well, it is a great time to be part of St. John's Hospital, and thanks for having me back. It's a real honor to be leading this organization that has provided care to our community for the last 100 years, and providing care, high quality, safe care, innovative care, and to look back and understand everything that has taken place over the last 100 years, it's quite an accomplishment.
The hospital's been in Maplewood for the last 26 years now, and before that it was on the St. Paul's East Side.
Right. 100 years ago, Dr. F.J. Polanki gathered a number of community and business leaders together, and they decided that there was the need for another hospital in St. Paul, in the east side of St. Paul, and at the location where Metro State now is. That was the location of the original St. John's Hospital, and it started out as St. John's German Lutheran Hospital. And then if you look over the history of St. John's, they've been very much connected with the community and have grown with the community through flu epidemics, through the Depression, World War II, having clinical advances, new innovative things. And in the middle 80s, 1985 to be specific, the hospital in Maplewood opened up to serve the community of the Northeast metro area. So starting on the east side, serving the East Metro community, moving out to Maplewood to serve the Northeast community. It's been quite a history and has been all about this community connection. And then actually a decision to close the east side facility where Metro State is and make the Maplewood location the main site for St. John's Hospital. So it's been again, a real treat to be part of this organization and to see the commitment and dedication of our employees and staff.
When you're talking about the commitment to the community, I was looking back at some of the historical things that during the 1918 flu epidemic, that the hospital actually turned the beds over to the city, made them available, charity case, brought in hundreds of patients during that time.
Yeah. Yeah, again, it was, and when I look back over the history of St. John's, it's really that spirit of doing what's right for our community and our patients. And whether it was new programs, adjusting, letting the city get more involved, moving out to a new location, it really, I think, speaks to the physicians and the staff of our hospital and our commitment to providing high quality, safe care.
You still have some nurses that were working for years at the old location?
Yeah,
still
not back to 1911, but there's been a few nurses who were part of the East Side facility and now are out in Maplewood. And as I've talked to them about all the changes they've seen and how proud they are of that, they really speak to, when I ask them what's the key, and it's really this commitment to improving quality every day, this dedication. And I have found that. I've been the CEO at St. John's for 8 years, and that level of commitment to our patients I see with both our physicians and our employees.
And you had mentioned about the innovation. I understand St. John's, when it opened in '86, that it was one of the first in the Twin Cities to have private patient rooms. Before then, they were you shared a room, or you were in a ward even before that.
Right. Again, I think another example of innovative thinking, and now, you know, there are very few hospitals that don't have private rooms, but St. John's was one of the, if not the first, to have a whole hospital entirely of private rooms.
What would be some of those other things that St. John's is known for with their innovation in that?
Well, there's a number of things. You know, one of the things, probably one of the more recent things, is our robotic surgical program. About 4 years ago, working with our physicians as part of Metro Urology, we acquired some new robotic technology for our operating room, and since then we've had a number of our GYN physicians use this type of technology. But starting 4 years ago, being innovative, having a team to come together, a surgical team that really is specially trained in using this new technology, we've grown to the point where we've treated over 2,500 patients with this robotic technology. We've been recognized nationally for the clinical care we provide, and we're the 16th busiest robotic program in the country.
Wow.
So that's one area of innovation. Other areas is in our cancer care, some of the new technology. They're really having a multidisciplinary approach where we offer general oncology care, but we have lung clinics, prostate clinics. We have a breast program where we have specialists come together to really come up with the best diagnosis and treatment plans for our patients.
And I had done a video on another unique program, having the nurse navigators that help the patients, especially those through the cancer care program.
Yeah, it's a very important part of our cancer program is having nurse navigators, and our nurses are very skilled at understanding, starting out with the clinical aspects of cancer care, but also the emotional side of what patients are going through, and the importance of having information, and the importance of understanding the options. So our patients are connected to a nurse navigator who helps them really navigate a complicated healthcare model and delivery system. So it's someone that our patients can call and consult with and help give them options.
Which is really good, especially you have that whole emotional thing going through cancer. So big celebration, huge celebration this month. What are some of the activities that are going to be open to the public that you want to encourage people to stop by the hospital?
Well, lots of activities, and as I've stated, it's about our relationship with the community, and this is an opportunity for us to give back to the community, to recognize that partnership that we've had and been fortunate to have for 100 years. It's starting off with a community leader reception on September 15th. And we'll be talking a lot about the history of St. John's at that event. We then, on September 22nd at 7 o'clock, we'll be having a community worship service at St. Andrew's Lutheran Hospital in
the church?
Or excuse me, at St. Andrew's Lutheran Church in Matamidi at 7 o'clock, and the community is welcome to attend that. We're then going to follow that with an internal celebration with our employees and staff, a picnic where we're going to have style shows, and we're going to open up a cornerstone and really relive some of the high points of St. John's history. And then Saturday, September 24th, we will have a community open house starting at 10 o'clock, where we'll have a lot of information booths. We'll have physicians available to talk to people in the community about the programs we offer at St. John's. The day will start off with a waffle breakfast in partnership with the Lions Club in our cafeteria, and that starts at 9 o'clock. So there's a lot of events coming up in the next couple of weeks, and we hope people will come out and join us for
And
those.
you had mentioned the robotics. They'll actually get to try out, I understand, one of the Da Vinci.
That's right. That's the
Some
plan, to
hands-on
get some
experience.
hands-on work and to really show people what goes on behind the scenes.
Final comments about the open house, the celebration, the centennial?
Well, I think just again, this is about celebrating our relationship with the community, Our physicians and staff have been really committed to providing best care every patient every time. We've received some national recognition, but it's really about our relationship one-on-one with our local community. And we're just excited to have been providing care for 100 years and looking for many, many more in the future.
All right. Thanks, Scott North, CEO of St. John's Hospital, and congratulations.
Thank you.
And we'd like to thank you for joining us. We hope you'll join us next time on Inside Healthcare. We'll see you then, everyone.